Good afternoon, good evening, everybody. My name is Sandro Galea. I have the privilege of serving as Dean of the Boston University School of Public Health. I use he, him pronouns. On behalf of our school, welcome to this public health conversation. These events are meant as spaces where we can participate in discussions about the issues that matter most to our health. Health is shaped by ideas that are shaped by the process of conversation and debate. At these events, we welcome expert speakers who guide our thoughts about issues of consequence for building a healthier world. Thank you for joining us for this conversation. Thank you to the many who work to make these events happen. In particular, thank you to the Dean's Office and the Marketing and Communications teams, without whose efforts none of these conversations would take place. The core mission of public health is to improve the health of all populations, with special care for those who have been marginalized. The transgender community has long faced the conditions that create marginalization. Stigma, misunderstanding, even hate have too often characterized the public's engagement with issues concerning the rights of transgender people. In recent years, the transgender population has had greater visibility, and we have made progress on a range of LGBTQ issues. However, with this visibility has come backlash, political attacks, and a public conversation often lacking in respect for the dignity of transgender populations. Today, we will discuss how we can advance transgender health in the context of these challenges to build a healthier world for all. I'm very pleased to turn over this event to our moderator, Cam Burns. Cam Burns is a senior audience producer at National Geographic, working on strategy across social platforms and developing campaigns for editorial projects. He previously worked in audience roles at Politico and Wired, with a focus on enterprise projects and emerging platforms. Cam is also a co-founder and board member of the Trans Journalists Association. He's a co-author of the TJA Style Guide, and he currently contributes to media relations and consulting for the organization. I look forward to learning from him and from all of today's speakers. Cam, thank you for joining us. Over to you.
Thank you, Dean Galea, for the introduction. It's such a pleasure to be moderating today's discussion, and it's such an important discussion to be having right now. I'd like to introduce the speakers for this program. First, we'll hear from Alejandra Caraballo. Alejandra is a clinical instructor at Harvard Law School's Cyber Law Clinic. Prior to joining the clinic, Alejandra was a staff attorney at the Transgender Legal Defense and Education Fund and a staff attorney at the LGBTQ Law Project at New York Legal Assistance Group. Alejandra's professional focus has been on advancing the civil rights of LGBTQ people in a variety of civil legal contexts, such as healthcare access, immigration, and family law. Next, we'll turn to Dallas Ducar. Dallas is the Chief Executive Office of Trans Health Northampton. Dallas is on faculty at Northeastern University, University of Virginia School of Medicine, University of Virginia School of Nursing, Columbia University, and the MGH Institute for Health Professions. She serves as the co-chair of the Primary Care Alliance and is on the LGBTQI Federal Policy Roundtable and advocates for gender-affirming care nationally. Our third speaker will be Caroline Medina. Caroline is the director of LGBTQI+ policy at the Center for American Progress. In this role, Caroline engages in strategic advocacy, coalition building, and impactful research in order to advance progressive policies that improve the well-being of LGBTQIA+ communities. Caroline's work focuses on developing policy solutions that positively impact LGBTQI+ communities by expanding access to healthcare and health insurance, improving economic security, and enhancing data collection on sexual orientation and gender identity. Fourth, we'll hear from Ames Simmons. Ames is a queer white transgender man who holds a senior fellowship at Duke University School of Law. His work is grounded in community-based anti-racism, anti-violence, and anti-poverty efforts to achieve justice for transgender people and collective liberation. Finally, we'll close the presentations with Treandre Valentine, Executive Director of Massachusetts Transgender Political Coalition. Treandre is an immigrant of mixed ancestry from the Republic of Trinidad and Tobago. They have over 10 years of experience in the anti-violence movement and DEI work specializing in LGBTQ+ inclusion through an anti-oppression framework. Once our speakers have finished their presentations, we'll begin our panel discussion. I would like to ask our audience to please submit your questions through the Q&A feature on Zoom, not the chat, and I will ask our panelists to wait until our discussion to answer those questions. And with that, Alejandra, take it away.
Thank you so much for that wonderful introduction. So I wanted to start kind of where my background comes around trans health. As a trans woman, I obviously need access to gender affirming care, but my professional focus has been particularly prior to coming to the clinic here, litigation around gender affirming care when I was at the Transgender Legal Defense Education Fund. And it was particularly interesting to see because I joined in 2019 and I ended up leaving for Harvard in 2021, the kind of shift in focus and rhetoric around gender affirming care, particularly in the litigation space, and the way that it was being changed and the type of rhetoric being used in litigation was being influenced more and more by online discourse rather than necessarily the kind of typical anti-trans groups normally or typically based in the religious right. So your kind of groups like Heritage Foundation, Alliance Defending Freedom, and all of those that had historically always had anti-trans views, but mostly based in religion and their own personal beliefs. What really started to happen was, particularly starting at the beginning of the pandemic, is this kind of fixation on trans youth and focusing on kind of, I think, the work that had been initially started by gender critical feminists in the UK, and there was a bit of cross-pollination. But then really starting in 2021, things started to shift, right? So even in the litigation, things stopped being about concerns about safety and efficacy. First and foremost, it started to become these kind of narratives about detransitioners, these narratives about trans youth, even in litigation, that had nothing to, had no issue, almost nothing to do with trans youth. They would just bring in these young detransitioners that are being flown around the country by these dark money groups because they're just appearing nearly everywhere as the same usual folks. And really starting at the beginning of this year, the narrative focus really started to change into a very, very dark direction. So particularly in February and March, when we saw the passage of the Don't Say Gay bill, in the background, there were social media accounts like Libs of TikTok that started pushing what I call the groomer libel, which is essentially repurposing a term that had been used for child sexual abuse survivors to describe the process of which an adult abuses their trust to sexually abuse them, and to instead use it as a slur against LGBTQ people. And when I saw that kind of shift in rhetoric, it kind of alarmed me because as someone who's monitored anti-LGBTQ forums and spaces and some of the far right extremist spaces for years, that was a market escalation. And then it became a quick trolling tactic on social media. And we quickly started seeing these kind of new grifter accounts like Gays Against Groomers. And the language started to become very heated, particularly with regards to trans youth. So, starting in June, we saw, the attacks on drag events, and by August, that kind of focus where Proud Boys and far right white nationalists and white supremacist groups and literal neo-Nazis were showing up at drag events. Starting in August, I saw almost a complete focus starting on gender affirming care. And it was no surprise to me that when they started going after Boston Children's, it was extremely shocking, but it was not a surprise that immediately providers started getting tremendous amounts of harassment, death threats, calls for their execution. Just the worst things imaginable. And people were just saying it openly, and it was being incited on mainstream television, right? So we had someone like Tucker Carlson going on at 8 o'clock and quote unquote using the term sexual mutilation of children to refer to gender affirming care. And lost in all of this is all of the decades of research and best practices developed by WPATH, by various medical associations and doctors, and it's just being flattened into this kind of just moral panic. And so right now, the kind of tactics that we're seeing in many ways are kind of a reflection of what happened with the anti-abortion movement in the 90s. There was kind of this public face where people were demonizing abortion, but in the background, there were groups that were creating lists. They were stalking and doxing providers and threatening providers. And in many ways, we're already starting to see kind of the hallmarks of potential actual violence where somebody could actually be killed or a violent attack could be perpetrated against a gender affirming care clinic. And what makes this different from abortion is that abortion clinics tended to always be standalone clinics that could be attacked, whereas gender affirming care clinics are almost usually associated with a hospital or put into a hospital campus or built into a hospital campus. So this is directly affecting not just the gender affirming care clinics. You hear of Boston Children's Hospital, they're at full capacity due to kind of this convergence of the flu, the respiratory virus, and COVID. And it is kind of this perfect storm where they're over capacity. At the same time, they're receiving bomb threats. They've received 2 bomb threats this week. And it just keeps happening. And the same actors that are pushing this, when they're called out on their violent rhetoric and the escalatory tactics and the incitement, oftentimes engage in gaslighting and minimization of the role that they played in inciting this. Last Friday, someone was arrested in Texas for threatening to murder a doctor affiliated with Fenway. And they used the same term that had been used by a lot of these same actors, that is, they're castrating children. And so as a result of that heated rhetoric, it is resulting in this environment where there is a direct use of what I term stochastic terrorism to essentially use force and intimidation to shut down gender affirming care across the country. And that is driving the animus now. We are going to see probably one of the worst years for anti-LGBTQ bills in state legislatures, probably in modern history, I believe, in the upcoming year. And it could have been worse had the midterms not gone the way they had. But already in Texas, I believe there's 13 anti-trans bills filed, some that would criminalize drag, others that would criminalize gender affirming care. I believe there's at least 7 separate bills that would criminalize gender affirming care. Some of them are carbon copies of each other. Others are variations. One would reclassify it as genital mutilation. Another would classify it as felony child abuse. And so, and Tennessee has also introduced a bill, and we're starting to see all of these bills that essentially criminalize gender affirming care. And then in Florida, what we're seeing is kind of the more administrative route, where it's not legislative, because they couldn't get it through the legislature. They're politicizing a medical board to get the policy through, to make it much, much harder. And one of the ways that they've actually kind of adapted to litigation is they know that they're losing when they have trans kids who are plaintiffs who are facing the immediate cessation of their medical care. So they're now including grandfathering provisions. And what that does on the litigation front is makes it harder for, in many ways, it's good because there's no threat to children to lose their healthcare like suddenly without warning. On the other hand, it makes it much harder to challenge these bills and to get preliminary injunctions, because it makes it harder to challenge under the irreparable harm standard. If you're only speculating that a trans kid who's 8 or 9 may go on puberty blockers in the next 2 or 3 years. And so that, and then by that point, it becomes much harder to challenge. So I think they're kind of learning on that end. But beyond that, it's creating this just broader atmosphere of intimidation. It is causing displacement of the families of trans youth. People have had to flee Texas to other states. There have been multiple stories sharing that. And it's, I mean, what is going on is just beyond heartless. It is just cruel, and the cruelty is the point. I think in many ways they want to push out trans people out of public life, and not only that, to basically cut off all access to gender affirming care. And you know, it's just this just broader reactionary movement that is just kind of in many ways like all hitting at once. And in many ways, gender affirming care providers who had been doing this work for years are suddenly now faced with death threats to them and their families in ways that they had never thought was possible a year ago or 2 years ago. And so I think there's going to need to be an adaptation in how to protect staff when these situations arise, how to protect patients, and how to minimize the risk of this kind of stochastic terrorism, in the sense that it's entirely random. Any video now can be selectively edited and captioned differently than what the video actually says. And suddenly it's seen by, you know, an account like Libs of TikTok has 1.6 million followers. And next, you know, the switchboards are inundated, right? And then there's the local threat with local militia groups and Proud Boys and others. A lot of the people protesting are far-right extremists like the Proud Boys. In other parts of the country, like in Texas, there's actual neo-Nazis involved. So like in Florida, it's NatSoc Florida, and in the New England, it's NSC 131. So this is really stretching into the realm of this kind of extremist movement that is really pushing back on this, and that is really at the heart of this, and is being kind of pushed on one end by, you know, a lot of mainstream conservative figures, and then on the other end there is this kind of slow creep of trans panic within the kind of mainstream liberal press, which is, I feel, mimicking what has happened in the UK, where the story becomes, well, we don't believe like all of the things that the far right is saying, but there's got to be something there, and maybe we just have to find the balance on both sides this. And so they're both sidesing this and essentially saying we have concerns, right? And you know, and all of these things, like the recent New York Times article, particularly around puberty blockers, the WPATH did a tremendously good takedown in terms of all of those things. Those concerns were all addressed in the most recent standards of care. And so they tried to push this huge kind of thing, and it turns out to be like not as big a deal. And, you know, but at the same time, that starts to erode support from, you know, most of the people who are kind of just, I would say, apathetic, right? And otherwise generally are supportive, but don't necessarily know a lot about trans people, and just are. And so that from that aspect, that becomes particularly distressing, because it really is a slippery slope, right? So 4 years ago, there was a few articles in the Guardian and the Times of London and all those things about trans people. And now it is, this past Sunday on the Telegraph, there was an entire page of 6 different anti-trans stories. So it is just, it becomes a creep where it becomes a media obsession to the point where it is unlike anything. And so I've ever seen before. And so that becomes another threat, where there's this like popular media where they feel like they have to both sides something, where one side is like, we just want to exist, and the other side is, we don't want them to exist. And I don't understand how you can have it. There's a compromise there. There isn't. And so, yeah, it has just been particularly distressing. I think this also corresponds with just a broader, you know, what's happened with the Club Q shooting, and the things that I've seen online in terms of the rhetoric on extremist forums. It is just going to be a very tough road for the next few years in terms of how do we navigate this, where it's not just, you know, the typical people filing lawsuits or denying access to care. You know, it is now literally terrorist organizations plotting harassment and you know, potentially attacks on gender affirming care. And so I think there really is going to be it's going to be a very difficult period over the coming years. I started to be very pessimistic or almost dark or bearer of bad news in that way, but I think we have to be realistic with the moment and the challenges that we face, because I think in many ways a lot of people were caught off guard. And as someone who has been monitoring this for the last 5+ years, I think in many ways I still am being caught off guard by how quickly this escalated. I was never believed it would have gone this route in this way. That being said, and I like to end on a bit of hope for my 2 cents. So many of the candidates this past cycle that ran on explicit transphobia, like Carrie Lake, who attacked the Democratic candidate's husband because he's a therapist who provided provided therapy to a trans kid in a case, and you know, she lost. A lot of these candidates like Tudor Nixon and others that ran heavily on transphobia and opposing gender affirming care lost. I think the exception being Abbott and DeSantis in Florida, But beyond that, in places where it was middle of the road swing states, it lost. So I don't think that this is a message that's resonating with most people. This is just a very loud and very violent minority that is pushing this.
Yeah, thank you so much, Alejandra. We're going to kick it over to Dallas next. I think you're muted, Dallas.
Sorry about that. You think after a long time of a pandemic, I would know how to use Zoom. So my name is Dallas Ducar. My pronouns are she and hers, and I am the CEO of Trans Health. And I want to thank you for that, Alejandra. That was an amazing explanatory, contextual history of where we are today. These are very real concerns that our team at Trans Health has struggled with, and the healthcare environment is changing and it's becoming politicized. And I'm grateful to live in New England and in a state that has made it clear that gender affirming care is legally protected healthcare. This is a new landscape with the new state bill that was passed in Massachusetts, H 5090, an act expanding protections for reproductive and gender affirming care into law. And as a result, we have seen refugees come across state lines. And we at Trans Health, we want to ensure patients can see themselves reflected in their providers, to know that it is possible to live a long life and to have joy. And what we're seeing here is political overreach in states when it's at its most dangerous, exploiting the authority in an unscientific and malicious way to dictate what is considered appropriate healthcare. And even further, an appropriate way for individuals to speak, to dress, to act, and express themselves. Not since the Civil War have state laws been so discordant, when one state's felony is another state's commitment. And so we have to, I believe, really show up for the ability to protect human rights broadly and each individual's right to self-determination. One phrase that you might see a lot online is facts don't care about your feelings. This has been a common catchphrase to dismiss the complexity of gender and the value of gender affirming care. But when it comes to healthcare decisions, why are we allowing political pundits to decide what are considered facts? And why not instead really respect the experience of scientists, providers, clinicians, people who are trusted and trained to provide healthcare? And I think we've really seen disinformation around science and healthcare spread really widely in the past couple of years. The COVID-19 pandemic was really a catalyst for questioning what role the state should play in healthcare. And quite rapidly, political pundits have conflated their own opinion with facts. We've seen conspiracy theories spread, and this has really led to that dangerous precedent that Alejandra was talking about of conflating science with ideology. Everyone in this case believes that they know best and can dictate what is best for others. And the rise of politically motivated facts, put that in quotes, has quickly bled over from arguments on the efficacy of vaccination to that of evidence-based gender affirming care. The concept of gender is complex, which is why whole fields of study are devoted to it. And gender affirming healthcare recognizes this complexity by emphasizing individual freedom and choice combined with comprehensive clinical care. So let's be clear, gender affirming care is just good healthcare. It is evidence-based care. It allows each individual to better know themselves, their identity, and their own needs. Nothing is being done overnight. Clinicians are acting thoughtfully and deliberately because these interventions are life-saving. So whenever I tell someone about affirming care who doesn't really understand it, that it's a model that respects your individual choice, that it's guided by science, that it gives you the time you deserve in a clinical visit, I'm generally met with the response, I wish that my healthcare provider was like that. And the fact is, the national discussion around affirming care is so divorced from the actuality of what happens on the ground. Affirming care is respecting those deeply held American principles of freedom, liberty, and acknowledges that you can pursue your own happiness. And who wouldn't want that? The ability to choose your own healthcare. And we've seen that every major healthcare organization has supported gender affirming care. And as Alejandra was talking about, there's this fringe group of Americans that are resorting to this domestic terrorism. So much so that the Department of Homeland Security has issued warnings that LGBTQ people are under increased risk of domestic terrorism. And instead of reasonable debate and dialogue between scientific and medical experts, which is what we used to see, we have now seen belief in personal ideology motivate real-world threats of violence and real-world violence. And across the country, as Alejandra noted, we've seen bomb threats towards children's hospitals. We've seen some politicians, some editorial boards, some organizations calling for more responsive action by the government. And I believe that we will continue to see these attempts to ban healthcare for political gain beyond this past midterms into the next general election. It's going to get, unfortunately, the risk is going to get worse for gender affirming care providers. And there are some that don't have access to large hospital systems to help protect them. And this is all motivated, not by facts, but by far-right ideology. So what are some of the steps in moving forward? In the end, especially as clinicians, public health experts, activists, students, anyone, we all want healthcare that cares for the whole person. Unfortunately, those that are most likely to react with violence will not be receptive to this message. So this is really a message to our leaders, to those who care. If we want to rely on facts and provide access to quality healthcare, we need to make quick changes right now and invest in longer-term changes. In the short term, we need to act quickly for the safety of our clinicians, for the vulnerable patients that do not have access to healthcare and who risk losing it. We need to protect healthcare providers and clinicians and teams and administrators. It's clear that this has only risen in the ranks of the media due to the recent midterms, to previous governor elections, to rise even further with the general. And we need you to be united in our call for state and federal funding now to protect clinics and hospitals' physical and cyber security. Clinicians need to feel safe to be able to provide healthcare. We need to protect telehealth. We've seen exponential growth in telehealth following the pandemic. This has allowed hard-to-reach clinicians to care for patients who need it most. Currently, insurance companies are announcing across the country that they're going to reduce payments for telehealth, which will undoubtedly result in less access to care. We need more access to care. We're entering an unprecedented area where, at least in Massachusetts, the state law says you can provide care for someone regardless of their location. And that's only possible through telehealth. So we need to protect telehealth, especially if we're to care for people in states where this care might be banned. And we need, all clinicians need to integrate conversations about identity and gender into more healthcare settings. We do not need specific clinics that can be targets. We need providers across the country talking about gender, normalizing it, and referring to experts when needed. We need this introduced in curriculums. In the long term, the journey towards an affirming model of healthcare will take more time, and the solutions to this remain the same that intersect with most other areas of disinformation in healthcare. Number one, invest in quality research. The current data does show that access to affirming care saves lives, and we honestly do not need more of that. We know that. Instead, we need to continue and increase quality research that shows the long-term effects of care. The response to the argument is not, we don't know enough. The response to the argument, we do not know enough, is not to ban care, but it's to promote further research. It's not to bottleneck care. It's to keep providing care and creating trusting relationships with patients so we can do more research. We need to invest in scientific literacy. Much of the disinformation about the role of science and peer review is due to a fundamental misunderstanding of how the scientific method works and how we as clinicians come to conclusions. We need more American citizens coming to fact-based logical conclusions, and that requires long-term investments in scientific literacy. We need to restore the fairness doctrine. We need to make it more applicable as well to online sources. Most of the disinformation is due to the fact that cable news, other news outlets, Facebook are not exposed to a diversity of viewpoints. This leads to a direct conflation of ideology with fact. So to get to the root source of this problem, we really need to stop disinformation. And so in conclusion, we know that access to affirming care saves lives. And the government and politicians do have a responsibility around healthcare. The responsibility is to help support an individual's freedom to be able to make to be able to access their best healthcare, and to support healthcare that's based on clinical outcomes and scientific fact. And we know that we need more spaces to be able to talk, and that violence in this country is unacceptable. We cannot allow it to continue. Terrorism is not acceptable. If we don't act now together, it's likely that other forms of healthcare will be under threat of physical violence. This will not just stop at reproductive healthcare, at gender affirming healthcare. Nurses, doctors, many clinicians are some of the most trusted professions in the United States. And clinicians need to use that trust that they've garnered from the public. We, as clinicians and our government and each citizen, has an obligation to act now. We have an opportunity to really work for our healthcare system, and we have to take a collective stand together. And this means actively fighting for a future where we listen to each other, respect different choices, and follow the truth despite someone else's opinions. Thank you.
Thank you so much, Dallas, for that presentation. We're going to turn over to Carolyn next.
Great, thanks so much. Can you all see that? Yeah, great. Okay. Excellent. So yeah, my name is Caroline Medina. I'm the Director of LGBTQI Policy at Center for American Progress, and it's really a pleasure to be with you all today. I wanted to start by providing sort of a brief overview of the kinds of anti-trans attacks that we're seeing across the country to give folks a sense of the prevalence and sort of variety of these harmful policies. So in 2022, more than 300 anti-LGBTQI bills were filed in states across the country, with a recent estimate by NPR asserting that approximately 85% of all these bills targeted trans youth in particular. Unfortunately, in addition to legislative efforts, multiple states have also taken executive action to restrict the rights of trans people For example, the efforts that Alejandro mentioned in Texas, as well as in Florida. Generally speaking, the most common kinds of state attacks that we're seeing fall into a couple of different buckets. So, for example, bans on trans youth participating in school sports consistent with their gender identity, prohibiting access to single-sex facilities such as restrooms or locker rooms, bans on access to best practice medically necessary gender-affirming care, and more recently, efforts to criminalize drag shows, which often have been using language that's so vague that they could effectively criminalize the existence of trans people in public venues. Unfortunately, but perhaps not surprisingly, we're also seeing echoes of these kinds of bills at the federal level. And with the upcoming Congress, it's possible that we'll see some more of these given a bigger platform, especially in the House. But for example, extremist members of Congress have also proposed legislation that aims to prohibit, for example, federally funded institutions from providing gender affirming care, censoring information on topics related to LGBTQI issues, and other extremist proposals. In particular, I wanted to uplift the current state of play as it relates to efforts to restrict access to gender affirming care, which Dallas has already spoken so well to. But in 2021 alone, legislatures in 22 states introduced bills to ban best practice medical care for trans young people. Several introduced multiple bills with a range of harmful impacts. In 4 states, lawmakers have enacted either partial or total bans on access to gender affirming care, though in some states, the laws are not currently in effect due to court injunctions and the great fights that our litigator partners are engaged in right now. Additionally, bills in 13 states would actually create criminal penalties for providing this best practice care to trans youth, even though this care adheres to guidance from leading medical organizations. As Dallas mentioned, we know gender affirming healthcare can be life-saving and is supported by every major medical association in the United States. So there is broad medical consensus about the benefits of this kind of care, contrary to what pundits and lawmakers and others pushing these anti-trans narratives and rhetorics would have you believe. To give you a sense of how quickly these attacks have escalated, it's worth emphasizing that prior to 2020, according to Movement Advancement Project, not a single state had introduced legislation specifically banning this kind of care. And it's just incredibly alarming in recent months that we've seen children's hospitals, academic health systems, physicians being targeted and threatened for providing this evidence-based healthcare. The next point I wanted to expand on is sort of the concrete and far-reaching harms of these anti-trans efforts that we've heard about, but supply a little bit of extra data as well. So not only is the passage of these kind of measures directly harming LGBTQI and specifically trans communities, but data also show that just the introduction of these bills, right, because they're often fueled by this hateful rhetoric and disinformation, are adversely affecting LGBTQI communities, especially youth. So, for example, to the first point, the Williams Institute estimates that as of March 2022, nearly 60,000 trans youth and young adults across 15 states were in jeopardy of losing access to gender affirming care. To the second point, data from the Trevor Project show that 66% of LGBTQ youth, including 85% of trans and or non-binary youth, which is just a staggering number, report that recent debates around state laws to restrict the rights of trans people have negatively affected their mental health. These detrimental policies are inextricably linked to and contributing to a rise in anti-LGBTQI and specifically anti-trans rhetoric and violence. So as we mentioned, we're seeing a surge of anti-trans rhetoric on social media and traditional media platforms. So this is not just the dark corners of the internet, but very mainstream platforms as well. The increased presence of and threats by far-right extremist groups showing up at drag shows, for example, as well as violent attacks on LGBTQI community spaces, such as the recent tragedy at Club Q in Colorado Springs. As well as horrifying threats on the lives of dedicated healthcare professionals providing evidence-based care and the hospitals where they practice. The combination of this rise in anti-trans rhetoric, disinformation, and violence is incredibly scary. A recent poll conducted by GLAAD found that almost half of all LGBTQ respondents, including 72% of trans respondents, reported being fearful for their personal safety in the current political environment. It's also important to remind ourselves of the context within which the current attacks are happening and locate them sort of within our knowledge of existing evidence. And, there is a wealth of evidence showing that discrimination, stigma, and violence, along with other determinants of health, really significantly affect the physical, mental, and behavioral health of trans adults. I briefly included some top lines here to speak to these issues. So, for example, according to CAP's Nationally Representative Survey, from 2020, more than 3 in 5 trans adults experienced some form of discrimination in the past year. In states across the country, we know that trans folks are not adequately or comprehensively protected by non-discrimination laws. And according to USTS, nearly 1/3 of trans individuals report living in poverty compared to just 12% of the overall US population. And I should clarify, the USCS is the US Trans Survey, which is an excellent source of data and that is currently being conducted now. And then finally, according to the William Institute's Trans Pop Survey, more than 6 in 10 trans adults reported being threatened with violence as adults. And I think, as we all know on this call, certainly, trans folks face really an epidemic of violence. Again, these are key drivers of adverse health outcomes and important to keep in mind, I think, for the conversation that we're having here today. Focusing more specifically on access to healthcare, Dallas already spoke to some of those barriers, but I wanted to uplift some of the research that CAP and others have engaged in related to discrimination and mistreatment that sort of underscored the importance of increasing access to quality, affordable care for trans folks rather than restricting access. So nearly half of trans respondents to CAP survey, including 68% of trans respondents of color, reported experiencing at least one form of discrimination or mistreatment by a healthcare provider. Over half of trans respondents, including 6 in 10 trans respondents of color, reported avoiding needed medical care when sick or injured due to costs. And approximately 1/3 of trans or non-binary respondents, including 46% of trans or non-binary respondents of color, reported they experienced at least one kind of refusal by a healthcare provider in the past year. And I really uplift these just to underscore the importance of improving access to care and the real value of providers who are engaged in evidence-based best practice affirming care for trans folks. So I also want to emphasize that, barriers to care are not necessarily new, but what is novel in recent years is the scale and escalation of state-led attacks, more directly, explicitly targeting trans folks, as well as Alejandra was discussing, these platforms proliferating misinformation and disinformation so pervasively. With that, I just kind of wanted to conclude. I'm a little cognizant of time, but I think I'm looking forward to discussing with the panelists sort of what I think is a multi-pronged strategy that we need to take here. So, for example, combating misinformation, disinformation, and violence that's been discussed, advancing evidence-based inclusive policies to improve access to care. It will also be important to strengthen and ensure robust enforcement of non-discrimination protections. Those aren't the end-all be-all, but they are an important tool. And also, we should be supporting local, state, and federal governments investing in key programming to improve the health and safety of trans folks and the providers that are providing this essential care. I look forward to today's discussion about these topics and more, and thank you again for the opportunity to be here today.
Thank you, Caroline. Also looking forward to the discussion coming up after this. Next, we're going to turn it over to Ames.
Hey, good afternoon, y'all. So I'm going to talk about a particular threat to trans rights by focusing on a different segment of the community than we've talked about so far. I want to talk about the assertion of free speech rights in order to avoid acknowledging transgender identities by focusing on older adults within the trans community. We certainly have seen a lot of First Amendment challenges based on freedom of religion, but we are starting to see challenges that are based on free speech. I feel certain that somewhere there's a far-right organization right now that's hosting a panel that's like the trans threat to the First Amendment and public safety or something similar to that. The case that I want to talk about in particular is the taking offense case, which is before the California Supreme Court right now. This is a case that is challenging California's LGBT long-term care facility residents bill of rights, which has a particular provision in it that says that long-term care workers cannot willfully and repeatedly fail to use a resident's preferred name or pronouns after being clearly informed of the preferred name or pronouns. Whether this is wholly or partially on the basis of a resident's sexual orientation, gender identity, or expression. So this taxpayer group called Taking Offense filed this lawsuit saying that their free speech right, that this was a content-based restriction on their ability to speak. So in other words, this is back to what Alejandra and Dallas had both talked about, where we're conflating science or facts with ideology. So like the fact that a long-term care worker has to use their mouth in order to make words is considered an ideology if they are talking about a person's using a person's preferred name or their chosen or affirmed name and pronouns. So there was a not good decision at the California Court of Appeal, and the case has been in briefing all this past summer and fall, and there are going to be a lot of people looking to the California Supreme Court in hopes that they'll put an end to this assertion that there is a First Amendment right to discriminate against people. The defense here is that using someone's pronouns is actually an element of professional conduct. It's not an ideology, and that the law is specifically tailored at long-term care workers who treat trans and non-binary residents differently than they treat cisgender or non-trans residents, because the cisgender people get to have go by their correct name and pronouns, but the transgender people don't. There also are some other bills in other parts of the country that could affect this. Like I'm thinking of the Stop Woke bill that passed in Florida that is trying to restrict the requirements for professional education that includes LGBTQ cultural competence, for example. And I want to speak specifically about how that affects trans people, and particularly, I mean, it affects older trans people who are in long-term care, and it affects trans people who are thinking about what's going to happen when we get older. There's been some studies that show palliative care team members, so people who are taking care of folks who have an end-of-life condition and trying to manage their pain, that in this survey, which was in, I think, 2020, 2/3 of the palliative care team members said they believe that trans people would be more likely to be discriminated against. And 1 in 5 of those people reported they had actually observed discrimination against transgender residents in long-term care. And this is important because experiences with healthcare discrimination in the past, cause transgender people to fear additional discrimination in the future if we can't advocate for ourselves. And that's particularly important in long-term care when we're thinking about potentially losing the capacity to advocate for ourselves because of dementia or cognitive decline. And we know that from the research that transgender people who have been subjected to discrimination, that this does impact their brain health, and that trans people who face discrimination are almost 8 times as likely to report poor or fair memory. That was a study, that was research that just came out of the PRIDE study, which I encourage everyone to enroll in out of Stanford. Transgender people of color are among the groups that have voiced the highest amount of concern about this kind of discrimination and losing capacity to advocate for ourselves in long-term care. And I want to particularly call up, to give voice to a 76-year-old transgender woman who said that it's the loss of independence and loss of control. The worst case scenario would be I lose all control over my life, how I would dress, and everything else. And I'm going to bring into the room, like, I'm going to just keep it really real with y'all. While some of the threat is from outside the LGBTQ community, I feel compelled to acknowledge that in some ways, transgender and non-binary people face threats from lesbian, gay, bisexual, and queer people who are cisgender. And when I try to talk about this fear in long-term care, for example, with folks who are not trans in the LGBTQ community, people respond to me with things like, is this like actually a problem, or is this just like something you're worried about and your friends have anecdotally, agree with you about this? And I think that like we have somehow made it a basis of whether something is scientifically true or not based on how many people we think that it affects. And I think that's a really dangerous way to determine who has civil liberties. Like other folks here, I don't want to leave you in a complete hole. I think there are tools that are at people's disposal that I think public health needs to be, particularly when it comes to aging, because the aging population is projected to double by 2060. We need to be rapidly increasing resources around people who are aging generally and transgender people in particular, and bringing solutions to scale. But there are some good starts here. The Transgender Law Center, for example, has a life planning documents, best practices resource that helps transgender and non-binary people think about if they want to put their wishes in an advance directive, for example. That can be, depending on your state, can be a powerful way to at least provide yourself some peace of mind that you're reducing the threat of discrimination. I also want to mention SAGE and the Human Rights Campaign Foundation's Long-Term Care Equality Index, which is a brand new tool that will help LGBTQ people be able to make some kind of assessment about whether a long-term care facility has LGBTQ affirming policy. And there are some criteria that are related to gender affirming services, as well as advanced care planning that are in that survey, which just closed its first edition. There's also important human rights litigation that is going on even outside of California. I especially want to mention GLAAD, single A GLAAD, as we call them, who does a lot of legal work in the Northeast, where you all are, brought a case against an assisted living facility in Maine that refused a transgender lady admission. So they took it before the Maine Human Rights Commission, who did find that there was reasonable grounds to believe that discrimination had occurred. And they settled that case out of court. Like this older trans lady who brought this lawsuit had long since found a different place that would accept her, but the settlement did require the facility to put in place trans affirming practices and protocols that will benefit trans people in the future. And I use that term human rights specifically. It's come up almost, I think every other panelist today so far has invoked the term human rights. And I think it's really important that, in Massachusetts, you're fortunate to have healthcare recognized as a human right. It is not so across our country, particularly in states where there's a lot more discrimination and fewer protections from discrimination, like in the Deep South, and particularly among communities that bear the brunt of marginalization, like Black and Brown transgender people, people who are immigrants, transgender people who are living with disabilities. And I think that until our country recognizes healthcare as a human right and disaffirms that discrimination is a civil liberty, then we're going to be having these kind of public debates about transgender people's humanity. And I think that in and of itself is a threat. Thank you.
Thank you, Ames. Now we're going to turn it over to Treyandre.
Hi, everyone. My name is Trey Andre Valentine. I am the executive director of the Massachusetts Transgender Political Coalition, or MTPC. My pronouns are he and they. And I'm sort of going to take you through more so a little bit of history in terms of what has happened in Massachusetts and leading up to where we are now. So sharing a little bit more work about MTPC. So our mission at MTPC is actually, we're currently revisiting this mission, but it is to work to ensure the well-being, safety, and lived equity of all trans, non-binary, and gender expansive community members in Massachusetts. And so our vision for the future is one where all trans and non-binary folks are valued and celebrated and can really fully participate and thrive in all areas of society and actualize our full potential and self-determination to shape the future. A little bit about MTPC. We are the nation's oldest advocacy organization that is trans-led. Many of the advocacy organizations are LGBT, right? And MTPC is one that is solely focused on trans communities. We do not, despite political being in our name, we do not engage in campaign or electoral politics. MTPC was originally started to actually bring about legal protections for trans people in Massachusetts. So we cultivate leadership, we educate the masses, and we advocate for equity and inclusion. Just a little bit of history of trans rights in Massachusetts. Like I said, MTPC was started in 2001, and we were the first to file legislation. That happened in 2007. The first piece of legislation was filed, and we really didn't get the non-discrimination protections included in gender identity and gender expression included in non-discrimination protections until 2011, but that came without public accommodations. And so a lot of the work of the organization went afterwards, after we had our ceremony here on January 19th. The next job was to really ensure that we could ensure public accommodations for our communities. And so that was filed in 2013 and again in 2015. So as you can see, the history of fighting for trans rights in Massachusetts was like an 18-year process. It wasn't until, and for public accommodations, people really thought that was really it was being named as the bathroom bill, right? And not understanding that public accommodations is about any public space. So that means hotels, that means healthcare facilities, that means public transportations, right? So we really needed to secure this. And in 2016, Governor Baker signed the public accommodation protection legislation. However, there was enough opposition to put this back on the ballot at the November 2018 ballot. And we knew that basically if we were to lose this, then all of the protections that we have worked for in Massachusetts for trans people were at risk. And I could not imagine trying to fight for public protections at this juncture right now where we are. And so in 2018, we, through a lot of work, a lot of sweat, a lot of tears, Massachusetts upheld public accommodations. We secured that for trans folks here in Massachusetts. And so in terms of MTPC, we were thinking about, like, what do we do now? Because is a small organization for the past 20 years. And if its existence, the only staff person has been the executive director. And the organization wanted to do more, wanted to start being able to respond to the needs of the community. And so now that we had these protections secured in Massachusetts, wanted to sort of pivot the work that we were doing, because we were solely doing legislative work in Massachusetts. And so when I came on as executive director in 2019, we conducted a community needs assessment. I'm actually going to put the links to this in the chat for you all. We surveyed about 340 folks in Massachusetts. We looked at basic needs, we looked at health needs, legal needs, access to services. I will also put the full report in the chat as well. And as you can see, in terms of like basic needs, like employment was a really high concern for folks. Housing, being able to pay bills, in terms of health needs, insurance coverage, having a knowledgeable provider, and access to gender affirming procedures, as well as behavioral health needs in terms of access to counseling, support groups, and mental health. One of the other things that we also looked at was some of the legal needs that folks identified, and that was their ID documents. And this really sort of provided the blueprint. This needs assessment provided the blueprint for MTPC's work for the next 3 years, so 2020 to 2023. So some of the things that we are currently focusing on in terms of sort of like building trans power to address some of those employment needs that folks are facing. We're working on the Trans Leadership Academy, which is a workforce development program. We are expanding the provisions of name and gender marker changes that we provide to be an online platform. We are partnering with Namesake, which is a trans-led business. We're trying to partner with more trans-led businesses as well as groups. And then we are also providing, building a network of inclusive and affirming not only employers, but also people who provide services like, like healthcare providers. Also, a part of this is next year we are launching something called the it's called GEAR, Gender Euphoria and Affirming Resources, where we're going to be able to provide folks with, right now it's limited to just binders, tucking materials, trans tape, but we're hoping to expand those resources. And also we have, there is the Trans Health Coalition that is housed under MTPC. So the Trans Health Coalition is really works to increase access to quality, equitable healthcare for trans, non-binary, and gender expansive folks. It was formed in 2013 after the passage of the Affordable Care Act to leverage the law to promote trans inclusive policies in the state. Sort of prior to this, someone would need to just independently seek out medical, legal, or advocacy guidance. And right now, through coordination of the coalition's local partners, the Trans Health Coalition is a resource to folks here in Massachusetts. We have collaborated with the Division of Insurance to issue required private health insurance to remove discriminatory exclusions for trans folks, organize listening sessions with Mass Health, successfully inform changes to Mass Health policies, provide education to insurance groups to remove trans exclusions in their health plans. And during the pandemic, we issued guiding principles for gender affirming care during COVID-19, focusing on tips for patients, insurers, and providers. So the work of the Trans Health Coalition is really focusing on removing this discriminatory barriers to coverage for gender affirming care, serving as a support for the trans community, and ensuring that trans folks in Massachusetts have the information they need to advocate for their own health needs. And so that is sort of the work that MTPC is doing now. I do want to say, Caroline brought up a great point in saying that, like while we do have protections, right? We have protections here, that does not, it's not enough. I'm actually just gonna stop sharing at this point. It's not enough, right? Yes, we have those protections, but trans people in Massachusetts are still being discriminated against, are still being turned away, are still being denied care, are being forced into gendered spaces. And also I really appreciate what Ames has brought up in terms of the experiences that we also have at the hands of our LGB communities, right? And that even in terms of the healthcare here in Massachusetts, that we have, Fenway Health is sort of the leading organization in terms of LGBTQ healthcare. And there are issues there. I'm just going to be real. There are issues there. There are issues where trans people are not necessarily feeling comfortable or safe, and so we need places like Trans Health Northampton. We need other places in Massachusetts for people to be able to go to and get the care that they need. And having something like Fenway Health, which is this big monolith. They try to say they're not a monolith, but that it's simply not enough. The things that we have right now are not enough. And really what we are in a crisis of is we are a crisis of ideology. And that's where we need to change, is that culture shift on who we value and how we value people.
Thank you, Trandre. We've had a couple of questions in the chat already about what tangible things folks can do and are already doing. So it's really great to hear about the work that your organization is doing. I'm going to ask a few questions and then take some of the audience questions we've gotten throughout the presentation, starting with Alejandra. You mentioned at the beginning that a lot of candidates who are running on these anti-trans platforms weren't elected. And so the conversations we're seeing online aren't necessarily reflective of the general population. You also mentioned that there's a lot of tendency to both sides these issues in a way that is not really accurate or reflective of the situation and the consensus among healthcare professionals. So my question is, what advice do you have for people trying to find accurate and accurate informative information that is actually reflective of the situation and general opinion?
Yeah, I mean, the way the digital online space is, it makes it very hard, in particular, the ways that some of these anti-trans groups disguise their organizations to make it look like we're just parents with concerns, particularly places like groups like GenSpect, other like Transgender Trend, and others. They really kind of target middle-class white women in a particular way. And they're the ones that kind of had a bit of more success kind of mainstreaming kind of extremist views about trans people, because they oftentimes purposefully recruit this kind of sympathetic kind of narrative of my kid came out as trans and they disowned me, and like, I don't, I'm like that kind of thing. And they purposely make them available to journalists, because journalists oftentimes don't have time to dig through and recruit, a dozen people to talk to about an issue. So that's one of the ways that they get this kind of influence. And then on the other hand, you have like kind of the more extremist side, where it's just inherently hostile. And so it becomes particularly difficult in terms of finding accurate information. I mean, obviously WPATH and the standards of care, but also the standards that have been adopted or used in the American Academy of Pediatrics, the American Medical Association, the American Psychiatric Association, the American Psychological Association. Basically, every the Endocrine Society, every major medical organization has at least some portion of their standards or guidelines that reference gender affirming care, and they've adopted essentially what WPATH has put in its standards. And so if you need accurate information, that's probably one of the best places to go. And I think just kind of one last final point, I think one of the unfortunate aspects of this kind of random disinformation campaign, particularly around pulling around information from websites and stuff like that, is that the first responses that a lot of providers have is to just immediately remove all the information, which, for provider safety, if they have to remove the names of providers, that's, I completely understand that. Like that's to protect their personal safety. But if, prospective patients and others can't see what services are offered, what is there, what's available, that becomes a new barrier for access to care. And there's a tight balance to be walked in that sense. But, I think it's not great for patients to not know, okay, this place offers this, they have more comprehensive therapy options, or, they have more integrated care where you can see all of the specialists in a single space, those kinds of things. And then for older folks who are seeking surgery, they can figure out which hospital does which and which provider, and trying to figure out those kinds of things, because otherwise it becomes impossible to figure that out just by checking out their website and understanding what's available. And so I think in that sense, we're losing valuable resources, and that's kind of the point, right? Is try to make this care more inaccessible to people.
Yeah, absolutely. I also meant to say, if anyone else wants to chime in on any of these questions, feel free to do so. Next one is for Ames. I had a question about a lot of these legislation has been targeting trans youth and healthcare for trans youth, but trans people have been warning pretty much since the beginning of that it would eventually impact trans adults and their access to healthcare, which we're already starting to see in Oklahoma. I think either yesterday or today, there was a bill introduced that intends to ban trans healthcare up to the age of 21. So I wanted to ask your thoughts on kind of the direction that's heading and how it relates to what you mentioned about aging and how that you think that will impact older trans folks.
Yeah, I saw that legislation, and also want to point out that Alejandro was mentioning the administrative restrictions in Florida. Like in Florida, if you're an adult, a transgender adult on Medicaid, then your gender affirming care is no longer covered. So there are already places in the country where trans adults are not able, are sort of legally barred, or face administrative barriers to being able to access care. The best example that I can think of to answer this is in the lawsuit around gender affirming care for young people that was criminalized in Alabama. And the filing by the state was, I think, 2 days after the Supreme Court decision in Dobbs that overturned Roe v. Wade, where the state said basically, we already saw that the Supreme Court doesn't believe in a right to bodily autonomy either. So we should stop saying that there's a substantive due process right for transgender people, period, to get healthcare. And so I do I think the direction of travel is clear. What's really baffling is how it's successful to go after young people who are so much more vulnerable legally and practically in our country.
Yeah, thank you so much. This is a more general question and it's a pretty loaded one, so apologies in advance, but One of the questions that I get a lot in my work is, this is such a small population, so why should people care or be invested in what's happening here? And that is for anyone. Yeah, Dallas, go ahead.
Yeah, I mean, I think this is really about the right for someone to be able to determine their own life, to be able to make choices, to express their own freedom. And these are values that we in this country supposedly hold so deeply, is the ability to make your own decision and to really hold up that freedom. And so, I think we have seen this history throughout fascist history, the history of fascism, where you see terrorists attack people on the margins who've been pushed to the margins. And then people say, they'll never come for me. But when you undermine the precedent to those very values of freedom and liberty and the pursuit of happiness, you are directly attacking the foundations of this country. And it is a road to fascism. And I believe that part of the roots of fascism really come from this epidemic of loneliness that we've seen in this country, and that people want to be a part of something bigger than themselves, the loss of a third space, the loss of community. And so they've instead found allegiance to terrorizing people at the margins and grouping together there and trying to really radicalize language that promotes violence. And so this is an issue that every single person should care about, because they will eventually come for you. This is not in isolation to transgender people or gender diverse people. And this is an assault on the very core values of this country and the question of who gets to be at the table. It's one we've wrestled with throughout our history, and it's one that we all need to be able to show up for.
Very well put. Thank you. Yeah, go ahead.
Yeah, if I could just add to Dallas's absolutely wonderful point there. I think it is absolutely true. I mean, from what I've seen is really like trans people are just kind of this like gateway to broader fascist views and broader anti-feminist, progressive views. I mean, and you see this in practical ways that it's being weaponized as well. The Kira Bell Tavistock case was not really about Kira Bell or about access to gender affirming care. The real point of that case was to undermine what they call Gillick competency in the UK, which is what allows minors in the UK to access abortion. They wanted to basically overturn the concept of Gillick competence in the UK. So really, that was basically a Trojan horse to push anti-abortion views, and some of the more prominent anti-trans TERFs in the UK have basically come out and said, like, I'd give up a right to abortion if it meant like we didn't have, like, trans people didn't exist, right? And it's like this kind of make them hate trans people more than they like their own rights kind of thing. And I think you're seeing it with some higher profile people like J.K. Rowling, where she'll have a new book or a new movie coming out and she doesn't even mention it. All she's talking about is trans people every single day, day in, day out, and it becomes an obsession. It's like brainworms. And I think in that way, like it really does serve a Trojan horse for more extremist views and ideologies.
Yeah, absolutely. I'm going to switch over to the audience questions now. We have one directed specifically to Caroline. Is there anything that can be done at a legislative level to regulate online hate speech and misinformation?
Yeah, thanks. I am actually probably going to punt this to one of our lawyer panelists that might have a better sense of some of the current state of federal legislation as it relates to First Amendment protections and things like that. Alejandra or Ames, I'm not sure if you want to jump in for this one instead.
Sorry, can you repeat the question in particular?
Yes. Is there anything that can be done at a legislative level to regulate online hate speech and misinformation?
Yeah, so this is particularly difficult because within the United States, we have the First Amendment, which explicitly limits a lot of the ability for the government to regulate almost anything regarding online content. That being said, there may be some options around regulation directly of the algorithms, requiring disclosure of how they work, and requiring or even open sourcing, or even potentially limiting the ability to use AI algorithmic amplification of content on social media, because that is what's driving a lot of it. Because these social media companies, they're almost the sole metric that they base their profit and growth on is engagement. And engagement is usually driven by emotion. There's positive emotions, right? Like joy, like you see your friends getting married, and you're like, you're really happy for them. But what really, really drives engagement is these three emotions of fear, disgust, and hate, or anger, sorry, fear, disgust, and anger. And those are the three that they really try to drive home with trans people, right? And so that's why the vast majority of content on Facebook for years was anti-trans, when it dealt with any discussion of trans folks, versus like a very small portion of it being positively for trans folks. And so when that's rewarded by the algorithm, it's not necessarily that a place like the Daily Wire, like, yes, they hate trans people, but they're also a business. So they are trying to follow what is driven by the engagement. They follow what the algorithm does. It's the same thing with YouTube influencers and others. And when you have this, essentially this entire funded way that is incentivized by the algorithms to do this stuff, then it basically makes hate profitable. You have entire grifters that come out of the woodwork that now have, you know, YouTube streams, Twitter accounts. They'll have their, you know, Shopify accounts, their Substack, everything else, and they can make, you know, if they're successful enough, well into six figures, just selling anti-trans hate. And so there needs to be a way that there's more accountable. Unfortunately, in the United States, the way that we balance free speech is basically only looking at speech in isolation, whereas in the European Union, they balance free speech along with the right to dignity, and the right for marginalized people to exist safely. And so there is that balance, and they understand that, and that's why there's much more protections in Europe. Unfortunately, we don't really have that kind of human rights centered framework in the United States, which makes it much more difficult. So I think in many ways, Europe can help on some of these things, and I think they absolutely will with the Digital Services Act and Digital Markets Act, but it is going to be very, very difficult in the United States to get any sort of regulation, particularly because this is something that everyone hates big tech, but nobody can agree on a solution. And then there's always the kind of perpetual concern that any solution will somehow disproportionately impact marginalized communities and make it even worse and reduce their access to critical online services. So it is not an easy problem by any means.
Thank you. Yeah, so we have another audience question that I'm going to direct at Treandre first. The person asks, are there any health departments in blue states that are working to welcome families that are seeking refuge from anti-trans legislation or unwelcoming environments? I'm going to broaden that to just government and non-government organizations, since that's your area. How can these states learn from each other to take in families that have the resources to move to a safer place?
So actually, can you just repeat the first part of the question?
Yeah, are there any organizations in blue states that are working to help prepare and welcome families that are seeking refuge from red states where they're facing discrimination?
You know, I actually don't really know a lot the answer to that. I'm not sure if Dallas might, in terms of seeing people fleeing in terms of like for healthcare, right? But I do know that folks have left their states and have been coming to Massachusetts. I think maybe possibly one of the organizations that may be keeping tabs and helping folks might be Mass Equality. I know that they have been doing some work as well on a legislative level as well in terms of trying to support folks. Dallas, you have anything to add to that?
Yeah, I'd say Massachusetts is really good. I have recently learned that Massachusetts refugee protection law does not protect against extradition for crimes committed out of state. whereas California, DC, and Illinois' draft law does. However, Massachusetts does protect against extradition of providers. And that's one of the concerns, right? Is if you're providing care across state lines, would you be extradited by another state? And in terms of the creation of refugee programs, I know that there is a special Senate working group in the Massachusetts Senate legislature with Senator Joe Comerford, Senator Julian Sear, and others who are specifically asked organizations like GLAAD, for example, which I sit on the board of, or Trans Health, to submit legislative priorities, and those were included in the legislative priorities to think about additional funding to protect refugees. Additionally, places like Trans Health have thought about refugee programs to fast track, get people back on their hormones, get people medical care, but it should not be the duty of sole organizations to do this, right? Places like Massachusetts or California or others should be thinking about how to create substantive programs and not just protections against extradition, right? Because it's different about saying we won't do this, we won't comply, versus we actually believe there's a positive right to this. And I'm sure Alejandra knows more about this too.
Alejandra, you're muted.
Sorry. Speaking of extradition, I actually have a law review article coming out in CUNY Law Review within the coming days or weeks, literally about the topic of interstate extradition with regards to abortion, but also applies to gender affirming care. And unfortunately, with the extradition clause in the United States Constitution, if someone commits a crime that is a crime in one state, like let's say Texas, and they provide gender affirming care, and then they flee to Massachusetts or California, the Constitution and the Supreme Court precedent on that is quite clear that those states would have to extradite those people. It's where if the crime is kind of committed interstate, so like let's say a provider in Massachusetts provides gender affirming care to someone in Texas while they're physically located in Massachusetts, Massachusetts does have the discretion then to refuse to extradite. And so that's where this has been a bit thorny and that particular area of the law. And some of these states have been trying to figure that out and how to work that. This was, to be honest, has not been an issue since the Fugitive Slave Clause Act, which my article went into kind of extensive detail about, because that's the last time that there's been this kind of discordance. Like Dallas, I like the way you framed it. It's like basically one state's human rights is another state's, in terms of abortion, is potentially a capital crime, but it could be a felony, right, for gender affirming care. And in terms of orgs that are providing grants, I know Campaign for Southern Equality last year or earlier this year was providing some micro grants to people to be able to move if they absolutely needed to. But this is something where historically nonprofits in the LGBT movement have not been great about in providing mutual aid, just because oftentimes the way that they're funded is not structured to provide this kind of direct mutual aid. And I think they really need to start thinking about how to use some of their general funds to provide this kind of mutual aid.
Just real quick, we have about 1 minute left, so if we can keep final thoughts short, but definitely want to hear from Andre and Dallas before we wrap up, if that's okay.
Yeah, I just wanted to say really quickly, like what's happening at the legislative level in Massachusetts is right now that the Senate is, during the summer, they had a debate of abortion and gender affirming care, and they have formed a working group to examine sort of additional legislative and policy remedies. And so they are looking at some of the list of policy barriers to gender affirming care as well as abortion.
And I was just going to mention to Alejandra's point, in terms of funding, hospitals especially have access to 340B as a program, which generates a substantial amount of cost savings and can be used for housing specifically or other social determinants of health. We don't always see that happen, but hospitals should be showing up and doing that. Hospitals have the funding to help with housing vouchers and other things. They have programs for this. And even as simple as creating a support group over Zoom for folks in other states, that would be so easy for hospitals to do. So there's ways in which we can really use some funding and resources that we have access to now to help those who are in other states. And I believe we have a duty to do that because healthcare does not know state lines.
Absolutely. That's a great note to end on. Thank you everyone for joining us today. And thank you to our wonderful panelists for such a informative and thoughtful discussion. And I will pass it back to Dean Galea.
Well, I just want to echo what Cam said. I want to say thank you, Cam, Ames, Dallas, Alejandra, Triandra, and Carolyn. Thank you for the really, really interesting conversation. But most importantly, thank you for everything you do every day. Thank you for the work you do in the world of creating a better world. And I want to thank our participants for engaging with the conversation, and wish everybody a good rest of the afternoon and evening, and a restful holiday season. Everybody take good care. Thank